Tor, thank you so much for joining us today. Great to see you. It's always a joy speaking to you. But today we're going to have a chat, the two of us, about everything to do with voice. So do you want to kick off and just tell everybody a bit about who you are and what you work with?
Sure, thanks Sarah. So yeah, my name's Tor Spence and I am a voice specialist speech therapist. So I've always worked with patients with voice disorders, and in more recent years also a range of upper airway disorders as well. And I work part-time NHS, and then I have VoiceFit, which is my private speech therapy practice. So I'm crazy passionate about voice and voice therapy and working with the disordered voice and helping people to prevent against getting voice disorders. And I do some teaching and supervision, and I run training courses for voice therapy skills. So it's great. I love working for both the NHS and in private practice. That's a lovely combination to do. And I work in voice clinics. And I scope people, so I examine larynxes as well as part of assessment and therapy. So yeah, that's me, I think.
Wonderful. Well, just to tell everybody, I'm Noala's clinical director on the Insta today, but I'm also a speech and language therapist, but I'm a paediatric speech and language therapist. And voice is something that is very specialist, and it's something that's always intrigued me clinically and professionally. But it's not something that we would treat at within my practice. We'd always refer to a voice specialist. So clinically as well, it's wonderful to speak to you today more about everything to do with the world of voice. So you say you work in NHS and you've got VoiceFit and you're working in clinics and hospitals. Do you work with young children, teenagers, adults, mix?
I'd say the youngest child I probably work with directly is about 4 or probably 5.
Oh, wow.
I have had referrals for younger children, for example, with a vocal cord paralysis that's happened at birth or after surgery. And that's usually not directly with the child. That's just advising the parents about how to best manage it. Or they see if it's led to swallowing problems, they'll see a dysphagia paediatric specialist. But on the whole, for voice therapy, usually they are at school age children. They need to be old enough to, understand the concepts of what voice is and how it works. And as fun as we can make voice therapy, it is about working with the child and the parents to make changes to how they use their voice, how they look after it. So they need that level of understanding. And then I work all the way through to the oldest person, any age. So anyone can have a voice disorder at any age so it's a big variety.
And what are your kind of common referrals that you get through?
There's a lot of different voice disorders that exist. We classify voice disorders probably in 4 main groups. The muscle tension or functional voice disorders, where the larynx is normal, but the muscles might not be working quite well enough or quite efficiently enough, or they've been strained. Then you've got structural or pathologies or organic voice disorders, where there are lumps and bumps that might be just growing there. Or they might be growing there as a direct result of how someone uses their voice. And then you've got inflammatory problems due to reflux or other medical conditions. And then you've got neuromuscular problems. So that might be down to a vocal cord paralysis or a neurological disorder that's affected the voice. So there's a big range of people we'd work with. A large percentage of people are occupational voice users. So singers, performers, teachers, and just people that use their voices a lot, because that puts people's voices at more risk of damage. So yeah, big range.
Big range. And so we talked about, working with a child, with a family, if it's with an adult, obviously the strategies. My perception, and obviously this is why we're tested to correct me, is that voice therapy is a bit different from kind of your classic speech therapy, in that it's more management of strategies and management training going forward in a functional way. Is that right, or is
A
it
lot
a
of
bit
it
different?
is. Yeah, a lot of it is. So what I love about voice and voice therapy is that you are really trying to help support someone and facilitate them to make change. And you might link that into any kind of speech therapy, obviously, when we're working with patients to make change. But the voice, a lot of voice is under our control, and a lot of what we do will impact on the voice. So when you have any voice patient, it's always very multifactorial. There's lots of things to consider and reasons for why a voice disorder may have started or why it's been maintained, and the way that we compensate for voice disorders. So it's very detailed, lots of factors to consider. And then a lot of the work is directly therapeutic. So there are exercises and things, but a lot of it's about behavioral management, control, helping people, you know, really find ways to prepare and actively change what they're doing, sometimes in their lifestyle, which can be quite emotive, quite challenging. But what's great about voice therapy is you can see quite quick changes sometimes. I mean, quite immediate changes sometimes, which is wonderful. And I really like the sort of the art and science and both avenues through voice.
And tell me a little bit more about your therapy work. Is it face-to-face, online? How do you tailor it?
It's a big mixture. So before March 2020, I'd never done a teletherapy session.
Really?
Yeah, never.
How funny. Because look at your website. It looks like you look like an old candidate in a good way.
Well, I think, you know, we all had to start doing it so suddenly, didn't we? And we'd been pushing for it, certainly, you know, in the NHS trusts I've worked for, we've hoped so much that we'd be able to do some video work, but it wasn't until the first lockdown that it was suddenly, poof, it's ready to go and we can do it. So I now do both. My private practice is all online because it's convenient for me and for the patients, and I can reach a wider range of people from further afield, different areas, and it just works. And I've got, you know, you have to be quite flexible and quite dynamic, like we all do, you know, with the way that we assess people. And because there's a lot of observation involved, I have to find ways that I can really kind of observe people's breathing and their positioning and posture. But it works really well. We have to be prepared, prepare the patients, plan, get them to record their own voices and send the samples in to us. But we're seeing good outcomes, and I love working face to face, don't get me wrong. I love it, and I wouldn't ever stop. But a mixture is good, I think.
And it's great to be able to offer it as well as, as you know, because some people, you know, can't access face to face for whatever reasons, you know, and so online works very well to be in the comfort of their own home. It kind of de-escalates stress, anxiety, having to find a clinic room and all that goes with it. If they're coming to you with a voice issue, which may be linked to stress.
Exactly. Yeah, I mean, I can think back to there's numerous times when, you know, either in the hospital setting, when patients with possibly kind of stress-related voice changes have arrived, you know, off the back of a really stressful journey, can't find anywhere to park. And that's not conducive to spending a relaxed 45 minutes working on your voice and exploring maybe some psychological reasons for why your voice isn't normal. So, and I think that's another thing, you know, when someone's online, they're in their own home usually, aren't they? And they might feel more comfortable when these voice patients I'm working with, but also for me to see them in their own environment can be quite interesting as well. And not just because I'm nosy about people's houses, but
looking at their bookcases. Yeah, actually, it's a clinical reason.
Yeah.
No, and I think that's the thing about voice. It is a very specialist area of speech therapy. You know, absolutely, what you're offering as well for newly qualified and therapists coming through, even for someone like myself, over 11 years experience, I wouldn't even touch a voice patient until I'd had supervision training from you, which you offer on Voice Fit, as well as the clinical work, because it is very specialist, and what you're doing, from what you've described, is the art and the science, which is very different from maybe just doing simple speech articulation work, which is quite systematic. and you mentioned as well the psychological reasons as well that you're unpicking. So it's a very multi-layered therapy, it seems.
Yeah, it is. And I get, I love the supervision work I do, because I get to work with adult and pediatric kind of generalist therapists who might not see very much voice, like you mentioned, Sarah. And it's, people are worried to get started. They're not sure what they need to have achieved in terms of competency levels, because there aren't official competency frameworks for voice therapy. So I've tried to create one that fits with that first year of working in voice, or for people that are generalist but want to just have enough skill to start seeing not the most complex of cases, but they would almost certainly be managed in specialist clinics anyway. But it's just, those children perhaps with other speech and language problems who a therapist might notice that the voice isn't quite right as well, and just knowing with confidence what to do next, or how to, what to recommend moving forward, is what I really like to support people in.
Well, on that note then, I think it's very fitting that we now move to, we always do this in our Insta Lives, 2 big pieces of advice from you, Tor. One piece of advice, what would you give a family or an adult client that you're working with? What piece of advice would you give? And the same to a therapist, like we just described, who maybe is a generalist, has a child or an adult on her caseload, suddenly there's a voice issue that's arisen. So 2 pieces of advice, one to the client and the family, and one to the speech therapist.
Okay, so if I go in, to an adult patient, I think what's really important is that they ask enough, if they don't fully understand what voice therapy is all about, then to ask questions and to really get a sense, when they're referred, what they're being referred for. Occasionally when people are referred to speech therapy from an ear, nose and throat clinic, for example, they come in and they might not fully understand what's involved in the process, and we would take time to explain that as well. And that's a really important part. If a patient's not sure exactly what to expect, then they should really ask those questions. And I think understanding their instrument, if they're not quite sure what they're trying to work with, they can't see it, but so much of voice therapy is about how it feels and how it sounds and tuning into your body. So yeah, to really ask questions if they don't understand their instrument and what they're trying to do. And I think making sure that they are ready and prepared, and that's with the help of the speech therapist, because voice therapy requires changes and work on the voice, and sometimes quite difficult changes need to be made to a lifestyle that's overwhelming the voice or partly causing the disorder. So yeah, they need to be prepared and in the right place to make that change. And I think for speech therapists, I would say, first of all, if you're working with voice, it's to understand your own instrument and to look after it in the way that you would be recommending, which isn't always easy because we're all quite vocal as speech therapists. But certainly as you're starting out in voice, to be able to really explain how the normal voice works and understand what can go wrong with it.
Brilliant. Fantastic. I think the one clear thing I'm taking away is that description of the voice as an instrument. I'd never thought of it like that before at all. That's a really good description, because as soon as you start thinking about it like that, you realise what you're working with.
And it's such an intricate, delicate instrument that in all of us goes wrong sometimes. But for most of us, we bounce back. But when people don't, the impact on lifestyle can be massive. But it doesn't take much in terms of understanding and appreciating the instrument to start helping it along on the road to recovery.
Absolutely. Brilliant. So looking at the delivery of your therapy, you talked about you doing a lot of sessions online, how it kind of reduces the stress levels of that patient client because they're in their own home, they're in their own setting, so they're really starting off in a place of calm. You are one of our fantastic Noala ambassadors, and we have our fantastic resource library. How have you been working with that with your therapy sessions?
Yeah, that's been brilliant. I mean, it's been very exciting to be part of like the development of some of the ideas behind some of the exercises, and that will be brilliant because particularly for pediatrics and for adults, you know, voice therapy exercises are about doing the voice work, but to have visual prompts and exercises, it is a great way, and to be able to share those online is fantastic, and to give people information sheets to go away with, and ideas for how they can exercise their voice. So yeah, that's been fantastic. Really exciting.
And what's your favourite, just to end with, what's your favourite resource that you use? What's your favourite kind of voice activity that you do?
I mean, working with children is really fun because we have to try and fit the concepts of healthy voice and good, smooth, easy voice into fun exercises to do with volume control or pitch variation. So that's quite fun, working with, for example, different kind of animals when it comes to volume control, and building in the concepts and their understanding of voice in a fun way. With adults, there's a huge kind of toolbox of voice therapy exercises I'd use with straws, lip trills, sort of gentle onset, yawns and sighs, lots of stretching, breath work, all sorts really. Hard to have a favourite.
I think it's great. I like the idea of the lip trills. That sounds brilliant.
Yeah.
Well, all our resources for voice on the Nuala platform have been devised and created under the guidance of Tor, who is our fantastic Nuala ambassador as a voice specialist. And the wonderful animals resources that you mentioned as well can all be found on the platform, ready to use for therapy sessions, and we have the integrated video platform. So just like Tor delivers her therapy sessions online with these resources, you can do so too through the Nuala platform. Tor, thank you so much for your time today. It's been fantastic to talk to you and learn more about voice, because it's such a niche part of speech therapy, but it's so important. And just your passion really comes across, and on your website as well, because you're not just delivering therapy to clients, you're supporting therapists in the clinical field and the newly qualified coming through with the supervision, which I think is so important for our profession as a whole. So thank you, Tor.
Thank you, Sarah. Really nice to chat to you.
Lovely. Have a good rest of the day.
Thank you. You too.
Bye.
Bye.